IBD is the common name used to describe two chronic diseases of the intestinal tract: Crohn's disease and ulcerative colitis that cause inflammation in the intestines. Crohn's disease can affect any part of the gastrointestinal tract from the mouth to the anus. Ulcerative colitis can affect any part of the large intestine. A third category, indeterminate colitis. Inflammatory bowel disease refers to IBD that has features of both Crohn's disease and ulcerative colitis. IBD is an autoimmune disorder, meaning the body's immune system attacks healthy tissues. It is not yet known what triggers these attacks and why IBD develops in some people and not in others. However, researchers are working to understand more about the mechanisms behind the condition and the impact of genetic, environmental, infectious, immune, and other factors, including the balance of bacteria in the gut. IBD can affect people in any ethnic or racial group, but statistically, people of Jewish ancestry have a greater risk of developing inflammatory bowel disease. Environmental factors may contribute. IBD is rare in the southern hemisphere. IBD causes a range of problems in the colon and rectum, but can also affect other parts of the body. The symptoms may come and go. People with IBD may experience flare-ups followed by periods with no symptoms. The first signs of IBD can appear after exposure to something that irritates the intestines, such as a medication, including aspirin, ibuprofen, and antibiotics, or a GI infection. The irritation or infection goes away, but the immune system keeps responding. 1. Abdominal pain in the stomach area, to diarrhea, sometimes with blood. 3. Urgency to have a bowel movement and fecal incontinence. For rectal bleeding. 5. Weight loss. 6. Fever. 7. Anemia. IBD usually appears as a sudden flare-up of symptoms. Most people diagnosed with IBD are age 35 or younger. There is a second peak of diagnosis in the 60s. There is no single test to diagnose IBD because the symptoms of IBD overlap with those of several other conditions, including infections and other digestive system disorders. Your doctor may recommend a combination of the following to confirm the diagnosis. 1. Thorough health and family history and physical exam, to colonoscopy with biopsies. 3. Upper endoscopy with biopsies. For stool sample analysis. 5. Imaging X-rays, CT scan or MRI. Blood work. Your workup may include tests for known IBD, biomarkers such as ASCA and ANCA antibodies, and other molecules that signal inflammation. Blood tests can identify IBD and, in some cases, predict the severity of disease and the frequency of future flare-ups. These two acronyms often get confused. Like IBD, irritable bowel syndrome (IBS) is a chronic condition that affects the intestines, but the diseases are very different. IBS does not involve inflammation. People with IBS may have periods of constipation, followed by periods of diarrhea. This could be caused by heightened sensitivity of the nerves in the intestines. The nerves in the intestines, or problems with motility, the coordination of nerves and muscles that move food and waste through the digestive system. 1. Nux vomica, 2. Mercurius sol. 3. Merc cor for hydrastis cank. 5. Arsenic album. 6. Carbo vegetable. 7. Ipecacuanha.